Okay, so what are we looking for in 2018? Given that I'm a registered nurse and a practice manager and a practice owner, I sort of look at this through different lenses. It's important to remember, and I'm probably going to base this around presuming there's a few people in the room who want to come into general practice or who are new into general practice. You've got to remember that with your interviewer that you're confident. I need confidence that you are confident coming into my workplace. There's other managers in the room too, and I have actually had someone say to me at interview more than once, sick of shift work, it's bloody hard in the hospitals, I just thought I'd come to general practice for a bit of a rest. Okay, yeah, no, you're not going to fit. I want to know what you know about me. You're interviewing me and I'm interviewing you, but I want to know that you've actually jumped on my website and you've actually done a tiny bit of research. It's not good to sit there and say, I don't know anything about you, but you're down the road and you'll do. Just don't say nope. Nope's not good. I would also, if you're not quite sure, frame it in, I'd be interested to learn more. What can you tell me about your practice? Regardless of your level of experience, if you're unsure at interview or new in the workplace, just ask. It's really, really frustrating when people don't say, what do you want from me? How can I better this place? Sorry about the glasses, that's sort of too far and this is too close and I'm blind. Getting blinded by the day, it's awful. Who's who in the zoo? Know who you're talking to within your nursing team or within your management team. In a general practice our size, 10 doctors, 4 nurses plus me, they pull me out of the cupboard when they're really busy, and a myriad of reception staff. You might find that one day at work you've got 10 bosses. So just know from the get-go who you need to be talking to about what, and that you're not treading on toes and you're not feeling that you're not heard and it's not going three paces before it needs to get to where it needs to get to, and have an open dialogue with your colleagues. That is your nursing colleagues, your receptionist, the whole team. Robbie and I know that we're running out of time, so going to zip on through. So these are 3 of my 4 nurses, and I'll just give you a little bio of them to show how you can fit. I always ask for experience, no matter who I'm employing, but that's just a bit of a snow screen because in January you get architects applying for reception jobs and things like that. So Trudy on the left, take about Trudy in the red jacket, as I said, trained with me. She's been working at our practice now for about 14 years. That's nearly half of her career. She took a hiatus for about 18 months to go back to recovery. I was going to say the name of the hospital, but I couldn't remember it. Just to allay her fears that she wasn't going to de-skill in the tertiary area, but fairly well found that general practice is her heart and home. In the middle is Neo. She came to us after about 4 years in aged care, and we thought, yeah, she's going to be great at wounds, going to be fantastic at wound dressing. Seriously, she was like a new grad. She said her job involved pill rounds and stopping the assistant nurses from killing each other. That was her job. So she's just finished, a couple of weeks ago, she got her certificate from her transition to practice through ABNA and Brisbane South PHN, which we have seen as old dinosaur nurses, we've seen her leaps and bounds improve clinically, professionally, personally. And Caitlin came to me as a new grad. So she did her training through, not on distant education, as a young woman, single mother, had a baby when she was 21, put herself through, came into my workplace as her first job ever. Did the transition to practice thing. She's been with us for 3 years-ish. She is fantastic. She's as good as any nurse that we have ever worked with because she's got old dinosaurs training her. And she started her midwifery this year. So we're so proud of her, like her mothers. But it shows where the diversity can fit into general practice, and don't be afraid to put yourself forward and think out there about where you want to go with your career. Slide. Absolutely reading nothing that I wrote. Embrace your professional development through APNA courses, of course. Many of the opportunities are coming through the PHNs, and sorry, Lou, to correct you, it's not Public Health Network, it's Primary Health Network, which you'd all be aware of. Look at what's out there available. Sometimes you've got to go looking a little bit, but look at what's available to you and grab it when you can. It might not necessarily be clinical, and it might not necessarily be, I'll stop saying that word, be relevant to your day job, but it might give you the ability to, what did you call it? Side hustle. Margaret makes goat's cheese and chili and stuff she sticks on Facebook, and I wish I lived in Yeppoon because it looks really good. Look out for scholarship opportunities and ask for support from your employer. I will always give my staff professional development support, but I need something back. So I need the value that you're giving me. I'm not going to say, yeah, sure, here's $200 to do that and $400 to do that if you resign in 6 weeks, you know. So there might even be a payback clause in there. I will send you on this course, but you must stay in my employment for 12 months because that's business. And I know that we talk a lot about how we can afford to pay this or pay that or whatever, but at the end of the day, the business has to stay open, and it's getting harder as the days go on. So don't sort of say, I deserve this. You've got to prove to me that you deserve it, and I will pay you back in buckets. And if your manager won't, tell them to ring me and I'll have a chat with them. So in very brief summary, be valued, but be valuable. Understand the difference between the private business and the public sector. Time and time again, we have nurses coming in from the public sector and they go, yeah, sure, here, Mr. Smith, you can have 14 of those very expensive dressings in your bag on the way home. Yet, no, I've got to pay for it. So just remember that the mindset is different. And we find that with GP registrars as well. They're clueless about the fiscal side of running a business. So bear that in mind and use yourself to drive innovation and best practice in your practice, and you'll be awesome. I recently had my CV reviewed by a girlfriend who's very high up in Canberra. I said, can you just look at this? She sent it back to me. Well, there was red pen all over it, and she goes, you're an idiot. You're so humble. Like, here, let me do it. So she sent me my CV back with her picture on it, which I then exchanged for a duck, and then I forgot to sort of put my own head on it. But she said, you are freaking awesome, and you've got to sing that. No one else is going to tell you that. No one else is going to say that about you. You've got to be the person to do that. So go in and just, even if you're not, you fake it till you make it, if you have to. Very quickly, because I know you all actually came to see Robbie and not the rest of us, I've left some flyers for AAPM on the thing. So if there are any managers in the audience or anyone aspiring to get into management in your positions, this is your go-to organisation. It's as valuable to managers as APNA is to nurses. So just thought I'd leave that there. And on that note, let me hand over to the brilliant one and only.